Hello everyone, in this video we're going to be discussing HIDA scans. So HIDA scans stand for Hepatobiliary Iminodiacetic acid scan. They're a diagnostic study utilized in nuclear medicine. They utilize radiotracer aminodiacetic acid, or IDA, which is where the name comes from. So this tracer is injected intravenously, and eventually the radiotracer is followed because it takes the path of the bilirubin metabolic pathway, and it's excreted into the bile duct. So this allows for visualization of the biliary anatomy and pathology. It's usually not the first line of choice of diagnosis. It's usually indicated before an interventional procedure or before a surgery. So, for example, if they kind of suspect acute cholecystitis, they really want to confirm that with a HIDA scan before they go in and do the procedure. It can be used to diagnose acute cholecystitis, chronic cholecystitis, biliary atresia, bile leak, and biliary obstruction. So in order to prepare for the HIDA scan, 4 hours of minimum fasting is required by the patient, and after 24 hours, false positives are more likely. This is because after 24 hours, the gallbladder becomes over-distended with the bile, so that can lead to false positive results. In certain cases, CCK analogs can be used in patients who've been fasting for long periods of time. For example, if the patient is NPO before a surgery or an ICU patient, you can use CCK analogs to stimulate the gallbladder. It's really important that the radiologist identifies a surgical history beforehand. They should also look at any previous imaging, such as ultrasound or CT scans, and patient medications list should be reviewed because in a lot of cases, certain medications can impact the contractibility of the gallbladder, which can impact the results of the HIDA scan. And relevant lab findings should also be looked at. So one of the most common pathologies diagnosed by HIDA scans are acute cholecystitis, and it kind of follows this criteria. So the gallbladder is not visualized on 60-minute time frame, then morphine is given. This is usually at a subtherapeutic dosage, which allows for contraction of the Spincyte or Bode, and additional 60 minutes of imaging is conducted. Now, if the gallbladder is still not visualized at the end of 120-minute mark, after morphine has been given at the 60-minute mark, then acute cholecystitis is diagnosed. So this is an example of a normal HIDA scan. Again, these images have very low resolution but high sensitivity, so it's easy to see the radiotracer. So this is a liver right over here, and this is the gallbladder. We can see the increased radiotracer activity right over here. It kind of moves its way downwards and goes to the bowel. So this is a small bowel, which is indicative of a normal HIDA scan because you have a clearly visible gallbladder and the bile moving along the pathway into the small bowel area. So this would be a normal HIDA scan. This is another example, and what we're looking for here is the gallbladder and the increased radiotracer uptake in the gallbladder working its way downward to the small bowel. So this is at 62 minutes, so the patient received morphine at the 60-minute mark after the gallbladder was not visualized and additional 60 minutes of imaging was conducted. And again, what we're looking for is the gallbladder, which we don't see work our way downwards all the way to the 120-minute mark, and there's still no signs of the gallbladder. So this would be indicative of acute cholecystitis because it meets our criteria where the patient received morphine at 60-minute mark after the gallbladder was not visualized, and additional 60 minutes of imaging was conducted when they received the morphine, and there's still no signs of the gallbladder. This is another case, and again, what we do is start off by identifying the gallbladder and then the bile movement through the small bowel area. So over here, we notice how there's no signs of the gallbladder and no signs of the bile in the small bowel, and work our way downwards all the way to the 180-minute mark, and we still see there's no changes really. So this is concerning for a common bile duct obstruction. This is a persistent hepatogram, and there's no signs of the bile in the small bowel or in the gallbladder. So this is a common bile duct obstruction. And what we notice here is the increased uptake of the radiotracer down here. This is likely the bladder, and this is because the bile is being excreted into the urine, so there's increased uptake in the bladder. Again, what we're trying to do is identify the gallbladder and look at the way the bile moves into the small bowel. Okay, so this example is a little different. So the patient received CCK and the gallbladder activity was measured, and this is an early frame picture, a middle frame, and a late frame picture. And over here we can see how the gallbladder, there's radiotracer activity noted here, here, and here. So it's present in all three of the frames. And we also notice the radiotracer activity in the small bowel here, here, and here. So it appears to be mostly normal, except for the fact that we look at the ejection fraction, which was identified is around 10%, and normal ejection fraction should be over 35%. So even though there's radiotracer activity in the gallbladder and the small bowel, the ejection fraction is severely low, and this would be concerning of biliary dyskinesia. This is similar to the last case. The patient received CCK and the activities measured over time, and the early, middle, and late frames are all shown, and the radiotracer activities noted in the gallbladder and the small bowel in all three of the frames. And what we also notice is the ejection fraction is measured to be over 35%. So this is an example of a normal scan as opposed to the last one, which showed biliary dyskinesia. In this example, the patient was an infant who received a HIDA scan in order to exclude biliary atresia. So again, what we're looking for is the increase in the gallbladder activity and the movement of the bile into the small bowel. So we can notice how the liver is over here, and then there's increased radiotracer uptake in the gallbladder and increased activity in the small bowel. So this is normal, and this can exclude biliary atresia. This is an interesting case of HIDA scan being done after cholecystectomy, so the patient does not have a gallbladder. And what we notice over here is at the 12-minute mark and the 10-minute mark, we can see this increased radiotracer activity right over here. So the patient does not have a gallbladder, although there is an increase in the bile activity right over here in the paracolic gutter. So this is concerning for a bile leak because there's no gallbladder, although the bile is filling up and going into the paracolic gutters right over here. And we can see that in the CT scan as well. There's no gallbladder, although there is this fluid right over here, which is concerning for a bile leak. So again, these are just some interesting ways of how HIDA scan can be applicable in diagnosing various pathologies. Thank you guys for watching this video, and I hope it was helpful.